Emma's stress echo. Meet Emma. She's a 56-year-old female from Hungary. Lately, she noticed shortness of breath upon her usual exercise routine with unstable angina. Her yearly routine exam showed an abnormal EKG finding with ventricular arrhythmia, which triggered her doctor to order a stress echo exam in order to visualize any possible coronary artery disease that might lead to a wall motion abnormality. Because this test is non-invasive, non-radioactive, and more precise than an EKG stress test, Emma agreed to the exam. And seeing that she can't hold down a good job, this inexpensive option fit the bill. On the morning of the exam, Emma was ordered to refrain from eating or drinking anything for 3 hours prior, especially coffee and smoking, as this would likely cause an irregular rise in heart rate. She put on some nice loose clothing and headed to the clinic. The doctor was very thorough at explaining the procedure, and since Emma is able to walk on a treadmill, the use of the medicine dobutamine was not necessary to use, which mimics exercise, and therefore the nurse does not need to attend to push it through an IV, so our echo tech will work with the cardiologist on this exam. We first start by putting on a 12-lead EKG to monitor the electrical signals to the heart. If the patient is extra hairy, shave the area to ensure proper conduction. The echo tech will start the exam by taking a series of clips from the parasternal long axis, the parasternal short axis, the apical 4-chamber, and the apical 2-chamber. It is imperative at this time to ask your patient to control their breathing before the treadmill exercise. For example, breathe in and hold, now breathe normal. Once the clips are stored, showing wall motion throughout the cardiac cycle, and the EKG strip is printed, it is time to get walking. The key to successful stress echo is getting the patient's heart rate up to the target heart rate. Emma's resting heart rate showed 80 beats per minute. We want to increase this by 90%, but we need to know what her max heart rate is first. So we use the same formula for everyone. Max heart rate equals 220 minus patient's age. Emma's max target heart rate for this exam will be 148 beats per minute. Once the treadmill is set to a proper speed and angle, Emma jumps on. But since Emma is physically active, adjustments to speed and angle are made to reach her target heart rate, or when she feels chest pain or any other signs or symptoms that could be harmful to her. Once this is achieved, we have 1 minute to get Emma back on the bed and a complete set of echo images and clips taken. While Emma continues to rest and catch her breath, we will study the images with the cardiologist to compare wall motion before and after the exercise. A side-by-side comparison of these will give you a visualization of any wall segment that has been damaged by coronary artery disease or myocardial infarction. Some offices score these wall segments on a point-based scale of 1 to 5, where 1 is normal, 2 is decreased or hypokinetic, 3 is no movement, akinetic, 4 is opposite movement, dyskinetic, and 5 is dystolic deformation or aneurysmal. This diagram shows the 17 heart segments and the arteries that supply them. The wall motion index equals the sum of all segments divided by the total number of segments. Ideally, this number equals 1. If the test results are abnormal, this could indicate blocked blood vessels in the coronary arteries like the left anterior descending, the left circumflex, the right descending artery, and the posterior descending. This diagnosis can be helpful in determining if more tests need to be done, like cardiac catheterization, to locate narrowed or blocked arteries and perform angioplasty. If the results are not severe, follow-up exams will be ordered to monitor patients' progress and administer medication like aspirin to thin the blood, cholesterol medication to decrease arterial blockages, beta blockers to decrease blood pressure, or nitroglycerin to dilate coronary arteries. Emma's exam results were negative, but doctor's orders suggested that she modified her diet.
Good girl. Good. Love you.
And got some good R&R to reduce her stress. Stay tuned for a quick word from our patient. If you're like Emma and worry about your heart health, don't wait until it's too late. Go see your cardiologist today.